Good morning, and thank you so much for joining us today for a virtual webinar titled COVID-19 Vaccination, Pregnancy, and Maternal and Infant Health. My name is Dina Pimenova. I am the project coordinator for the NYU Langone Community Health Worker Research and Resource Center, housed in the Department of Population Health at NYU School of Medicine and supported by the NYU Langone Community Service Plan. I want to thank Ms. Cheryl Hall at Caribbean Women's Health Association for reaching out to us and co-organizing and partnering with us on this important event. We have had more people register for this event than any other, with over 430 registrants across 24 states, which points to the importance and urgency of this topic and also to the reach of Caribbean Women's Network. Today's event is also hosted in partnership with NYU Community Engagement Alliance Initiative, NYU CUNY Prevention Research Center, and the NYU H&H Clinical and Translational Science Institute. Next slide, please. Before I introduce our speakers today, I would like to briefly go over some housekeeping. Everyone's on mute. The chat box is open for comments and sharing of resources. We ask that you please use the Q&A box to submit questions to the speakers. We'll have time to answer as many questions as we can during the Q&A portion. The slides and the recording will be made available. I will email those out as soon as possible, and please be sure to fill out the poll at the end. Next slide. Today's webinar is geared primarily towards community health workers, doulas, and frontline staff working directly with community members. We will first hear about the experience of a doula who has been working with pregnant clients throughout the pandemic. Then we will have two brief presentations in which we will learn about the safety and efficacy of COVID-19 vaccines for expecting parents, navigating vaccination during and after pregnancy, and resources for talking to pregnant clients and new parents about vaccinations. This will be followed by a moderated Q&A. I will introduce our speakers in the order in which they will present. Ms. Tasha Phifer is a birth and postpartum doula serving communities in Manhattan and the Bronx. Her passion for this work stems from the desire to protect, nurture, and advocate for Black and Brown mothers in their most vulnerable state while birthing. She's also keen on mothering mothers through the postpartum period as they find their way to the new normal of life with a newborn. Next, we will hear from Dr. Michelle Morse, who's the Deputy Commissioner for the Center for Health Equity and Community Wellness, and the inaugural Chief Medical Officer at the New York City Department of Health and Mental Hygiene. Dr. Morse is responsible for leading the agency's work in bridging public health and healthcare to reduce health inequities, guiding place-based and cross-cutting health equity programs, and serving as a key liaison to clinicians and clinical leaders across New York City. Dr. Morse is an internal medicine and public health doctor who works to achieve health equity through global solidarity, social medicine, anti-racism, education, and activism. She is a general internal medicine physician, part-time hospitalist at Kings County Hospital, co-founder of Equal Health, and assistant professor at Harvard Medical School. Equal Health builds critical consciousness and collective action globally in the pursuit of health equity for all. In 2015, Dr. Morse worked with several Equal Health partners to found the Social Medicine Consortium. This global coalition uses activism and disruptive pedagogy rooted in social medicine to advance health justice. She served as Deputy Chief Medical Officer of Partners in Health from 2013 to 2016, and now serves on the Board of Directors of PIH. In 2018, Dr. Morse was awarded the Soros Equality Fellowship to launch Equal Health and the SMC's global campaign against racism. From September 2019 to January 2021, she served as a Robert Wood Johnson Health Policy Fellow in Washington, D.C., and worked with the Ways and Means Committee majority staff in the U.S. House of Representatives. We will also hear from Dr. Terri-Ann Bennett. After completing a medical magnet program at Blanche L.I. High School in Pompano Beach, Florida, Dr. Terri-Ann Bennett received her undergraduate degree from the University of Miami in Coral Gables, Florida, before earning her medical degree from the University of Miami Miller School of Medicine. She completed her residency in obstetrics and gynecology and fellowship in maternal fetal medicine at NYU Langone Health and received the Fellow Teaching Award. She has participated in research concerning the clinical role of ultrasound and placenta ACRETA, spectrum disorders, preterm birth, hypertension, and genetic screening tests during pregnancy. She has written chapters on cardiac arrest in pregnancy and lectured on maternal mortality crisis in the United States. After joining the faculty at NYU Langone Hospital, Brooklyn, Dr. Bennett has participated in several quality and educational endeavors with residents, nurses, physician assistants, midwives, and attending physicians. She's passionate about teaching and health disparities, especially in relation to access to great medical care, preterm birth, preeclampsia, and maternal mortality. Lastly, I want to introduce our Q&A moderator, Ms. Clarissa Rios, a community health worker at NYU Langone Brooklyn's Family Support Center, collaborating with Red Hook Community Health Network. She serves both the communities of Sunset Park and Red Hook, Brooklyn. Her dedication to this work is to make a difference in a person's life, ensuring that they have a sense of well-being, knowing that there are people just like her who will be there to help them in their time of need. Clarissa is also presently serving on the NYU Langone Community Health Worker Learning Committee. And with that, Ms. Tasha Phifer, the floor is yours.
There we go. All right. Hello, everyone. My name is Tasha Phifer. Like she said, I'm a doula here in the city, serving Manhattan and the Bronx, and just wanted to share with you guys what I've experienced in the community throughout the pandemic, dealing, serving and working with pregnant women. So basically, what we're seeing, or what I've been seeing, is just really like a lack of confidence in the information that they're getting about, if they're getting any information really about the COVID vaccine, the COVID-19 vaccine. Um, I think the pregnancy itself is adding a lot of hesitancy for them, just because they don't know how it would affect them already because of the side effects. The range of the side effects is vast. Some people respond, some people don't, somewhere in the middle. So they're not only having to think about themselves with the vaccine, like they have a person growing and living inside of them. So if they don't know how it's going to affect them, and if it will affect them, is it the same effect on the baby? And they're not getting a lot of these questions answered, really. They're really just being told, you need to get vaccinated. And I'm for a mom, like that's like, okay, it's not just me. I have another person, and you're not really able to tell me with certainty or with any length of time. Like a lot of these visits that the moms go on, they can be rushed. They're not even getting sufficient information about how to deal with a yeast infection, or what does GBS mean if they come up positive. So there's not a lot of confidence in them getting proper information about this vaccine and how it will affect their body and their child's body. And then postpartum, um, what happens with the breast milk as they're breastfeeding? Like, are antibodies transferred to the baby? Like, none of these, like, they're not getting information um, that's putting their mind at ease, or that's um, making them confident in this. And even moms that I know who have gotten the vaccination, they were so nervous about it. And like, even after doing it, like, maybe I should have waited. I don't know if I did the right thing. So, and I'm sure that's normal. I mean, some people who aren't pregnant likely have felt that way, but um, just kind of not having a lot of information, or solid or concrete information, and a lot of time spent with them to help them feel comfortable about making this decision, whether they decide to or not. And a lot of them are not even deciding not to because they don't trust it. It's just they don't have the information and they don't know how it's going to affect. So maybe they're waiting until after they're not pregnant anymore. Um, so yeah, and then wanting to know like what to do with the baby afterwards, like getting how would it affect, them continuing to care for their child afterwards. Um, so yeah, that's basically like what I'm seeing.
Thank you so much, Tasha. I think we will move on to Dr. Morse's presentation.
Thanks so much, Dina.
Thank you.
Thank you also, Tasha, for grounding us in the way that you did with what you're seeing, what you're hearing. It is very, very, very powerful and very important. So just really appreciated us kicking off in that way. I'm really honored to get to be with you all virtually this morning. I hope that in the coming months, we're able to have conversations like these in person, but at least at the health department, we're going to do our best to try to make it as safe as possible for that to be true in the future. And for today, again, just really appreciate the chance to be a part of this dialogue and really looking forward to the conversation and Q&A as well, because that's always kind of the most fun part for me. So just briefly again, my name is Michelle Morse. I'm an internal medicine and public health doctor, and really honored to just share a few just framing comments and a little bit of data as well around COVID vaccination and maternal and infant health and what our approach has been at the health department. And also, again, looking forward to the next presentation as well from Dr. Terri-Ann Bennett, who I understand will go a little bit more in depth on some of the women's health specific questions as well. Next slide, please. So I just wanted to start with the way the health department has been approaching equity in our COVID response, as well as in our vaccination campaign. And the reason I think this is important is because I do think, the role of the health department in an emergency like the COVID pandemic, which is a once in a century pandemic, it really has a big part of our role is bringing partners together to make sure we have a shared framework and a shared series of values and actions around equity. And the health department has tried to do that in lots of different ways, and I'm going to describe a few of them specifically. But I do want to really underline that our approach was to build on the years of work in the health department through Race to Justice and efforts by prior commissioners and the current commissioner, Dr. Choksi, to really focus and ground ourselves in equity values and actions from the beginning. Some of the ways that we have tried to do that are described in our COVID-19 Equity Action Plan, which, as you can see, is widely available on our website. But specifically, some of the approaches that we know work when it comes to ensuring equity. First we have to acknowledge, of course, that the disproportionate and the unfair impact of COVID on communities of color, immigrant communities, and communities that have experienced disinvestment. We knew that pattern was going to play out. So the question is, how do we get ahead of it, right? If we know that there are going to be unfair impacts, how can we interrupt that pattern and interrupt that cycle to try to make sure that we get another step closer to equity? And at the health department, we also really believe that equity is a process. It is not just an outcome. It is truly a process. And so that's why our approach and our tools and our kind of key elements here all attempt to interrupt that pattern. And at the same time, what we already know just in the data from the first 6 months of the pandemic is that life expectancy for Black people was reduced by 2.7 years, for Latinx people by 1.9 years, and for white people by 1 year on average. And that's national data. But we already know that there have been unfair impacts, especially on communities of color. And yet we have to keep chipping away using things like our Equity Action Plan to make sure that the impact is less, and that access to all of the measures that prevent COVID, including PPE and hand sanitizer and masks and vaccines, among other things, that all those tools are available to all communities. So we have looked at and used messaging and community engagement as key approaches in making sure that COVID does not have a disproportionate impact on communities of color. We've also used our Race to Justice framework and our population specific strategies. We are the biggest health department in the country, but we are also very focused on place-based and neighborhood-based approaches, because we recognize, though, that even though New York City is the biggest city in the country, for us to have impact, we have to focus our resources on the communities that we know deserve more support and have experienced historical or current harm or disinvestment. And some of the ways we do that is through engaging with healthcare providers, community providers, and being in communication with communities through funding and supporting community-based organizations to do messaging and prevention work and community health worker engagement work. Next slide. I think that unfortunately this is a bit blurry, but hopefully you can. I'm so sorry that the image quality is so poor. But what I am trying to highlight here is that we are still chipping away at trying to make sure that the vaccination rates across age groups, across genders, and across racial and ethnic groups improve. And we are doing lots of different work to try to increase vaccine confidence amongst the Black community in particular. And as a Black woman and physician, I was particularly excited to be invited to this event because I know many of you yourselves are people of color and are also folks who are really engaging at the community level and really are seeing some of the challenges firsthand. So I really am excited to be in dialogue with you and hear more from you about how we can continue to do better and keep chipping away at this challenge, right? This is a truly historic vaccination campaign. And in fact, 12 million doses of the vaccine have already been given across New York City, which is a major accomplishment. And a lot of that is thanks to the work of you all, having one-on-one conversations, continuing to provide high quality and reliable data about the impact of the vaccine and how protective and safe and effective it is. So thank you for your work, and really, again, looking forward to your guidance and suggestions on how we can keep improving vaccine confidence, especially in the Black community. Next slide. One of the ways we have, again, attempted to do that in the health department is by really supporting community-based organizations in the communities where we know we have challenges and where vaccine confidence is not where we would like it to be. And we have to be very clear that folks who have decided not to get vaccinated yet should not be stigmatized or discriminated against or blamed. That there are a lot of reasons why some people have yet to decide to get vaccinated, and that anything we do to stigmatize or discriminate against them is not helpful and not productive. And what we should be doing instead is being in dialogue, using trauma-informed approaches, using motivational interviewing, and I'm going to describe a little bit of our work on that at the health department. And then really, again, more than anything, supporting the organizations that already have relationships and a long history of working in the communities that we would like to see, decide to have more people get vaccinated. So that's what we've been trying to do. On the left, you see what we call a heat map. And this is, sorry, my stomach is growling, I'm hungry. On the left, you see a heat map. The darker the blue, the higher the percent of people in that community that are vaccinated. And this follows a similar pattern to flu vaccination rates even before COVID. And it also follows a similar pattern to disinvestment and structural racism as well. And because of that, again, we want to make sure that resources get to these communities and that we're not blaming anybody. In fact, if we know that racism and experiences of discrimination or marginalization are part of the reason why communities do not have confidence in the vaccine, then we have to do the slow, intentional, generational work to reverse that trend and make sure that the resources are there and that those communities are prioritized and that the healthcare and health worker institutions in those communities are more trustworthy. So part of the way we're trying to do that is what you see on the right. It's by supporting and funding community-based organizations in the communities where we know there's been a history of bad experiences with health or healthcare, or there have been a history of disinvestment. And so on the right, you see the red and the I don't know, what is that, teal? Those are the communities where we're funding organizations, community-based organizations to work. And they're specifically the communities that have the lower rates of vaccination for now. And we've seen progress is the most important thing. We have seen progress over the past several months in improving vaccination rates. In fact, many communities have already gotten to 70%, so that's very exciting. Next slide, please. And I know I'm like running far over on my time, so I apologize, Dina. I'm going to move much faster. I'm just, there's a lot to say here. This is another example of the work that we're trying to do in this realm. As I showed in our health equity action plan around COVID, part of our approach is engaging providers and health workers. And that's, again, another reason I was excited to be invited to this conversation, because community health workers, doulas, and other health workers, our commitment is to make sure you have the information you need to share with the community members, patients, and clients that you're engaging with. And that's what this slide is about. This is public health detailing, where our teams go to the offices of health workers in these communities and share information, strategies, videos, materials, etc., with the providers to make sure that they have the information they need to be informed, and then to share that information with their patients and clients. Next slide. And I think it's really important to underline the safety of the COVID-19 vaccines that have been approved. These have been the most closely monitored in a very long time, actually. And I also want to say that the information that we have is that they are incredibly safe. And I just want to skip ahead to the next slide and underline specifically the way that we have put that information together for doulas. We have a series of recommendations on our website and materials specifically for doulas to keep you safe and informed. And hopefully these can be useful for you as you continue to have conversations with your clients and patients. On this one, I specifically do want to underline that people who are pregnant are unfortunately at a higher risk of having severe illness if they do get COVID. And that's why it's even more important for people who are pregnant to get vaccinated and to have all the tools they need to prevent and protect themselves and their baby from COVID. Because of that, what we know is that the outcomes are worse if you are pregnant and get COVID. Next slide, but it is preventable. Next slide. Again, this is guidance for doulas specifically on how to prepare your clients. Next slide. And yes, these slides will be shared, so please do spend some more time with these materials if you think that they would be useful. And here's kind of the final guide around doing suggestions and recommendations we have around how you can do this work virtually as well. Next slide. And I think this is my final slide. And again, sorry, I went a bit long here, but just again, underlining that vaccination is safe during pregnancy. I recognize that there's a lot of information out there and it's hard to know what information to trust. But again, so my sister was pregnant during the COVID pandemic, and we had a long series of conversations about the safety of getting vaccinated during her pregnancy. And she decided to get vaccinated. And she really wanted reliable information. And she wanted reliable information about the safety of the vaccine during pregnancy. And luckily, we do have lots of good information, reliable information about the safety of the vaccine during pregnancy. Specifically, I just wanted to share this brief summary of this most recent study, looking at over 105,000 pregnancies across the country, and really demonstrating that there was no relationship between getting vaccinated and miscarriage. And this is again just really important information for you to share with your patients and clients as well, because the last thing we want is we don't want anyone to get COVID when it's preventable, and we certainly don't want pregnant women, pregnant people to feel in any way, unsure about getting vaccinated. The data that we have is extremely supportive of the safety, and because of the higher risk bad outcomes for pregnant people who get COVID, it's more important than ever for them to get vaccinated. And again, I'm so thankful my sister did decide to get vaccinated herself. So sorry again to have gone a bit over, but hopefully this is helpful. And I really look forward to the presentation by Dr. Terri-Ann Bennett, and as well as the Q&A.
Good morning, everyone, and thank each and every one of you for being here with us this morning. My name is Terri-Ann Bennett. I am a maternal fetal medicine specialist. I work out of NYU Langone Hospital, Brooklyn. I am also the director for recruitment and retention and serve in this role through our Office of Diversity Affairs at the Grossman School of Medicine. And today I'm hoping to briefly share with you my clinical experience with prenatal and postpartum patients during this pandemic and talk a little bit about the COVID vaccine in pregnancy. So let's go ahead and move on to the next slide. Now, there has been, unfortunately, many outbreaks, epidemics, and pandemics throughout history, and undoubtedly this has affected obstetrics and obstetrical care across the United States. This slide sort of gives a brief outlay of the land from the 1960s, from the rubella outbreak to multiple flu outbreaks to the measles outbreak, et cetera, and the response that we have had throughout this time and how we change our counseling and or adjust things in order to be appropriate for the pregnant patient. And each infectious disease has had its own disproportionate effect on either the pregnant person or the developing fetus or both. And in several cases, the rationale for vaccination is for fetal protection, infant protection, but most certainly for maternal protection as well. Next slide. And during the early days of the pandemic, there were many, many challenges, let me tell you. As hospital operations really transformed our hospital overnight, women were still giving birth, pregnant people were still coming in for their prenatal visits. We knew nothing really about the impact of COVID-19 on pregnancy, how to keep our providers safe, and how to keep our patients safe and supported during this time. As many of you may know, there were many hospitals who even considered limiting who can come into the hospital with said pregnant patient. And some hospitals even had to practice out of an abundance of precaution by having some pregnant people labor alone. Fortunately, in our NYU system, we were able to always have our pregnant people supported, but we wanted to do that in a very unique way where everyone felt supported around this pandemic. But as we move forward to the vaccination, next slide, there were their own challenges. Now we feel much more equipped on how to handle COVID-19 in pregnancy from a treatment standpoint, how to hopefully prevent severe disease and to get access to our pregnant patients early before they get very sick. And now we're moving into the realm of prevention. And with the COVID-19 vaccine availability, there has been much question, much concern around the safety and questions about fertility as well. Next slide. We know that there's been much politics, an overload of information, even misinformation, especially across social media, and fear that's centered around the COVID-19 vaccine and pregnancy. This has created an opportunity, rather, for many of our national organizations and leaders in women's health to encourage healthcare workers and pregnant people across the United States and worldwide to consider getting vaccinated. Notably, the American College of Obstetrics and Gynecology, which is our governing body for how we practice OB and GYN, our American Society for Reproductive Medicine, which is the governing body around our fertility, reproductive endocrinology, and fertility practices, many of our nursing organizations, which are listed here, and our Society for Maternal Fetal Medicine for high-risk doctors have all come together really to support pregnant patients across the spectrum in order to put out the right information, accurate information, and to help people to feel comfortable with getting vaccinated. Next slide. Now, why should a pregnant person get vaccinated? The American College of Obstetrics and Gynecology across the board strongly encourages all pregnant women to consider getting vaccinated again for COVID-19. And the reason behind that is because pregnancy itself poses an independent risk factor for severe COVID-19 disease. That's why the American College, the Society for Maternal Fetal Medicine, and even the CDC and other organizations representing maternal and public health professionals across the board have recommended postpartum, pregnant, antepartum, and even lactating people and those considering pregnancy to really consider getting vaccinated, as we can know this to be the best method really to reduce maternal morbidity and mortality and fetal complications from the infection. Next slide. And although the absolute risk of severe infection, morbidity, and mortality remains relatively low, reports have demonstrated that pregnancy in itself creates a 3-fold increase in risk for ICU admission, a 2-point-fold increase in risk for needing ECMO, which is a way of when people get very sick, it's a specific type of life support where the blood is oxygenated and circulated outside of the body and then returned to the body, almost as if creating a heart-lung bypass when people get very, very sick, which can happen in the setting of COVID-19. There's also a 1.7-fold increase in death due to COVID-19 simply by being pregnant compared to symptomatic non-pregnant patients. The data also indicates that there's an increased risk for adverse obstetrical outcomes, and that includes a higher chance of needing a cesarean delivery, preterm birth, and even possibly stillbirth. Next slide. For Hispanic, Latinx, and Black patients are disproportionately affected by severe maternal morbidity and mortality and have been disproportionately higher incidence of COVID-19 infection and death. And these disparities caused by social determinants of health that act as barriers to health and the well-being of our pregnant patients have become even more apparent and exaggerated in this time of crisis. And to date, almost 200,000 pregnant people have actually received the COVID-19 vaccine, and there has been a very big push on getting real data to help people feel comfortable with getting vaccinated. Next slide. And that includes some of the studies that are even being done here at NYU Langone. This study, particularly done by some of my colleagues over on the Manhattan campus, highlights that there is a high antibody level in cord blood from pregnant women being vaccinated against COVID-19. What does that mean? We have postulated from the beginning that getting vaccinated in pregnancy will confer a protection for the fetus and subsequently the newborn when the baby is born. And this study basically sampled cord blood from the umbilical cord itself and found that there was a high antibody level, which is what we speculated, that these antibodies that are created within the body of the pregnant patient would then transfer through the umbilical cord, through the placenta, and to the fetus, therefore creating a protection, not a risk of infection for COVID-19. Next slide. Breast milk has also been debunked as being a source for infection, and breastfeeding continues to be strongly encouraged, chest feeding as well, strongly encouraged even in the setting of this pandemic. But rather than being a source of infection, breast milk has actually been found to be protective, as we have always speculated that the science would confer. Next slide. This study here looked at the SARS-CoV-2 antibodies in breast milk after vaccination and found that there was a high load of antibodies. Therefore, we think, and what we have proven with these studies, is that the antibodies are also within the human milk and then transferred to the newborn during the time of lactation and breastfeeding. Next slide. But we know that many people remain very worried. I've heard so many rumors about the COVID-19 vaccine, and specifically in relation to fertility. The American Society for Reproductive Medicine, ACOG, and SMFM have all come together to really try to debunk these rumors that the COVID-19 vaccine causes infertility, because that is absolutely not true. The evidence shows that COVID-19 vaccine does not affect fertility. Many of our infertility colleagues have put forth their own data from their own hospitals, clinics, and offices to show that this has not been affected during the pandemic in either the infection and or people who have been vaccinated. Next slide. Additionally, NYU Langone's vaccine center sites in both Manhattan and in Brooklyn are taking part in this new observational study to evaluate the immune response that's generated by the COVID-19 vaccine that are being administered to pregnant and postpartum people. This study, that's called the MommyVac study, is sponsored and funded by the NIH, the National Institute of Health, and it's conducted research really to evaluate the effectiveness of the vaccine, its protective effects, its safety, and how it provides protection for our babies. Getting vaccinated is not a part of this trial. Patients are really actually self-selected to enter this trial after they have chosen themselves to be vaccinated either during pregnancy or in the postpartum state, either vaccinated or boosted. And then the goal is really to get more information from mothers and infants about the immune response and markers of the vaccine and how it confers protection for both the pregnant person and their offspring. Next slide. And many of us on this call are providers. We are trying to do the work. We're trying to get out the right information to people so that they can make the best decisions for themselves and their family. And I wanted to sort of highlight some of the guidance that's out there from the national societies to help us in the engagement of discussing the COVID-19 vaccine with our patients. So there's two hyperlinks that are posted here on this slide. You can use your phone actually and click on each one, and it will direct you to some of the guidance from the national societies about how to engage in this conversation about COVID-19 vaccination, addressing some of the risk of vaccine side effects, these specific perinatal adverse outcomes which have been debunked, and how the vaccine creates a protective environment and decreases the risk of severe infection and disease from COVID-19 during this time. So I urge each of you to use this hyperlink to help to guide you with information that you could either print out for your patients or share with your colleagues in order to aid with counseling. And I know we're short on time. Next slide. And I'm looking forward to our Q&A discussions and very much happy to answer whatever questions you may have. But I just wanted to highlight my own personal experience with choosing to get vaccinated during pregnancy. I know that every pregnancy is special and unique in its own way. This is just my personal experience as a high-risk doctor, as a Black woman, as a Black person in America who deals with racism that's within our country and within our healthcare system. I know many of the things that our patients face. I face them myself on a personal level as well. My pregnancy itself had many, I guess, peaks and valleys and positives and negatives and risk factors being a Black woman in America. And I actually had an IVF pregnancy. So for my family as well, this was a particularly sensitive time, and decided to get vaccinated when the vaccines initially became available before all of this data was even present was definitely a challenging one for us. But I am so happy. I think that was the best decision I made for myself, for my baby, and for my family, was to get vaccinated while pregnant. And I'm extremely ecstatic that the data is now available to basically back up what we've been preaching from the beginning about what we expected to happen once people got vaccinated in pregnancy. So this is my own story of choosing to protect myself and my baby. Next slide. And I just want to conclude by showing you the outcome of my vaccinated pregnancy. My little baby girl, Zuri Nyameche Laibel, who is made with love, prayers, and a little bit of science. So thank you so much for your time, and I'm looking forward to your questions in the Q&A.
Great. If all the panelists have their videos on, yeah, if all the panelists could put their videos on, and Clarissa will start our Q&A session. Great. Got a lot of beautiful comments in there, Dr. Bennett, for your baby. Okay, over to you, Clarissa.
Hi, everyone. Excuse the little nasally voice. I'm a bit under the weather this morning. But let's start our Q&A. The first question that we got was, one question I get the most every time I'm doing vaccination events is, how come we got a vaccine so fast for this pandemic? Bear with me just one second. My computer's giving me issues, so fast for this pandemic, how can I explain it better for the community?
Can you repeat the question, Clarissa?
Sure. I'm not sure if everyone heard me. It says, from one of our commenters, one question that I get the most every time I'm doing vaccination events is, how did we get the vaccine so fast for this pandemic? How can I explain it better for the community?
I can start. Oh, sorry. I think my internet is maybe a little unstable. Can you hear me? You can hear me. Okay. Yeah, I think it's a phenomenal question. I think it's been one of the most common questions that we have been asked. And I think, again, it is a both in some ways it's an exciting advancement in science, and then it's also, of course, raised a lot of questions about were there steps skipped, or were there, how did we get this vaccine so fast when it took many of our other vaccines so much longer? But one of the ways to really reflect and respond to that question is, in fact, part of the reason some of our vaccines in the past took longer to develop was because there wasn't as much and as many resources being made available to enroll people in the trials and to move the process forward. And there were more resources available this time because this is truly a once in a century pandemic. So the entire world came together to really focus resources globally on the development of these vaccines. And those resources, and I mean, multi-trillion-dollar resources being made available so that the scientists could both focus, stop doing other things and really focus on vaccine development, and also develop and enroll people in the trials at a faster rate, because there was so much more focus on this. And so I definitely acknowledge that there are questions about how we were able to get this vaccine this quickly, but I have 1,000% confidence in the process. And it was really the global, coordination and the resource availability that allowed for us to get the information about the safety of these vaccines more quickly than vaccines in the past. Now, at the same time, we are also continuing to monitor the vaccines, but we now have over a year of experience, and all of it is very positive and demonstrates the safety of the vaccines over and over and over again. So I do very much acknowledge that that is a very valid question. And at the same time, I think we have, I will speak specifically for me and the health department in saying that we have nothing but confidence in the process and are thankful that the resources and attention and global coordination happened so that we can make these vaccines available in a very timely manner.
Thank you, Dr. Morse. Okay. Let's see. Okay. How long does the vaccine provide protection for pregnant women, pregnant people in general? How often will we need to be vaccinated?
Sure, I can take that one. So that's a great question. The answer to that is there does not seem to be a difference in recommendation for pregnant people versus non-pregnant people. I think that's really important to sort of pay attention to, because I know that many times, especially in the hospital, people are hesitant to sort of do things or have things done when they're pregnant. But the reality is many things that happen or can happen to you outside of pregnancy can happen in pregnancy with the same degree of safety. So I say that to say that the body is functioning very much similarly. And so there hasn't been an alteration in the recommendation. So right now, boosters are available for pregnant people as well. In fact, even encouraged, because like I stated before, pregnancy is a heightened state where you can get sick very quickly and get sick, really sick, and need to be in the ICU. And the reason behind that is because pregnancy is considered to be somewhat of an immunocompromised state. So that's why when you get pregnant and you get an infection, you're more likely to have bad outcomes. So that's why we're strongly encouraging the vaccine and the booster at the same recommendation across the board for all adults.
Awesome. Thank you, Dr. Bennett. Next question is, I'm wondering if there are any inclusions of Native American populations in the data presented. Vaccination rates, pregnant people infection, / vaccination rates, etc. I ask because oftentimes Native American numbers are not included in bigger conversations. The majority of children who have died due to COVID-19 are Native American, but I do not know much else as it relates to our Indigenous populations.
I can just start by saying a little bit about the vaccination rates amongst Native American Indigenous communities in New York City. We are in the process right now, actually, of publishing an epidemiologic brief on health in the Native American and Indigenous community here in New York City. So that resource will be available very, very soon. I can't speak as much to some of the national research data, but I can say here in New York City, at least, that we do have high rates of vaccination amongst the Native American community, but we also have our own work to do within the health department about making sure that the data is accurate and that we don't have miscategorization of people who identify as Native American or Indigenous. So that work continues for us. I think it remains a challenge for us. It's something we have very much committed to doing better at. And the epidemiologic data brief that I mentioned is one of our first kind of efforts. I shouldn't say first, but one of our many efforts in really trying to do better about how we represent and accurately collect data from Native American and Indigenous communities to make sure there isn't misclassification or misrepresentation.
Thank you, Dr. Morris. Let's see, next question is, what is the best time during the 9 months of pregnancy to get the COVID-19 vaccine?
We would say the best time is as soon as possible. There has been no data to show that getting the vaccination in the first trimester is harmful or getting it in the later trimester is harmful. So we recommend pregnant people to get vaccinated as soon as possible. We would hope people would get pregnant even before pregnancy so that they can be protected, but there has been no data to show that it is harmful if you get it early or later. So as soon as you can get it is the best time to get it.
Thanks, Dr. Bennett. Next question. Were there studies done on pregnant women who received the J&J vaccine?
So similarly to what I was saying before, pregnancy is one of those tricky states. So in the beginning of the pandemic, right, when we started doing these trials, the national organizations really tried to do a big push and advocate for pregnant people to be included in the trials. However, the reason why we're running sort of into such difficulty in our pregnancy vaccination rates is because pregnant people were not included in the trial from the onset. The reason behind that is because pregnant people are considered a vulnerable patient population and are usually not included in clinical trials across the board. So this is not anything new or specific to the COVID vaccine trials. So they were not originally included in the trial. However, there were people who were a part of the trials who subsequently got pregnant or did not know they were pregnant at the time. So that data has been collected. Since the rollout of the vaccine, like I said, almost 200,000 people have been vaccinated that we're collecting and following for outcomes. And with that data, we've been able to look to see what are the adverse outcomes, if any, and we have not shown that it has been sort of harmful in any way. So unfortunately, they were not included in the trials deliberately, but subsequently were a part of some of the trials and now are being followed to see after getting vaccinated if there are any untoward effects that have.
Thank you, Dr. Bennett. Next one. What do I say to patients who tell me I don't want to be a guinea pig when I offer them the vaccine?
I think Dr. Morse sort of highlighted this earlier in her presentation about how many people have actually received the vaccine, especially when we look worldwide. So at this point, no one is being a guinea pig. For one, there have already been clinical trials. And since the clinical trials, there has been millions of people that have received the vaccine. So no one at this point, I think, can say they don't want to be the first because no one is the first, essentially, is the reality of the situation. And there's been, like we said, no sacrifice in safety in evaluating these vaccinations. There's been no cutting corners. So I know that experimentation on human bodies is a real thing. And when we look at the history of medicine, racism in medicine has been a real thing. So these questions are valid and they're important to ask, but I feel very confident in saying that that is not what's happening right now.
Thank you, Dr. Bennett. Is there any science or research regarding babies of vaccinated mothers that have been born during the pandemic? Is anyone tracking the developing cognition, motor skills, etc.?
Sure, I think that's a great question. And that just highlights some of the long-term work that are ongoing in many different sectors across the United States. I cannot give you a specific study to go read at this moment because I think some of this data is going to come later, but those are valid concerns. What are the long-term effects? And I think we can all safely say that for some of these answers, we don't know, but we have the history of science to back us up about what we expect. And so far, what we've been predicting has been proven with studies that have come forth since people have been vaccinated. There's nothing about the science of the vaccine that makes any of us worry from a clinical standpoint that there should be those type of effects expected in the children who were vaccinated as babies. So do we have the data right now to show you a study of like 1 million people and what the outcomes are for 5-year-olds, 2-year-olds, 3-year-olds, et cetera? No. Will that data come? Absolutely, because the people want to know. But there's nothing about the science to expect that that should be an outcome.
Thanks, Dr. Bennett. The next question is for Tasha. Tasha, as a doula, have you lost any women due to contracting COVID during their pregnancy?
No, I haven't.
Okay. Let's see. Next one is for, again, for Tasha. Are doulas, like healthcare workers, mandated to take the COVID-19 vaccine in order to work with their patients?
No, not that I'm aware of. It depends on if you're working independently, then no, that hasn't been what I'm hearing from other doulas who work independently. That is not the case. You're not even really checked as you go in the hospital other than the regular screening that a visitor would have. But yeah, for different organizations that you may work for, depending on what their mandate is or their guidelines, you may have to be vaccinated to work with an organization that's providing doulas within communities in New York City.
Thank you, Tasha.
If I could just piggyback off of that a little bit, it would also depend, just in case there are any doulas on the line, on the hospital that you plan to enter, because every hospital has their own policies. And there are some hospitals that are mandating people who are visitors to be either vaccinated or at least have a negative COVID test within 72 hours. So I would say from a national level, absolutely what Tasha is saying, but on an individual level, it would depend on what hospital you're going into, if you're going into a hospital system.
Okay, this next for Dr. Bennett. Should we, sorry about that. Should we encourage women to get vaccinated every 6 months?
Well, right now we know about boosters, which are recommended 6 months after your vaccination. So yes, in that setting, we're encouraging pregnant people to get boosted right now. If the question is whether or not that will be the case every 6 months, I think we are still waiting for guidance on that.
Okay.
Yep, and I'll just add to that and confirm again that we aren't really sure what the pace should be out after this round of boosters, that everyone 18 and older who's 6 months out from Pfizer or Moderna, or who's 2 months out from Johnson & Johnson should get right now. After that, not sure yet.
And that, I think, answered our next question. If the vaccine is effective as claimed, why are people being encouraged to get a booster so soon?
The one thing I'll just add to bring a little bit more flavor to it, it is a very good question, is that unfortunately the Delta variant did change a little bit how effective some of the vaccines were. And they are extremely effective. And then they're even more effective when you get the booster. Part of the challenge with the Delta variant is that it has been a bit more transmissible. And so this, getting the booster shots really does help to increase your protection even more when you're 2 months out for Johnson & Johnson and 6 months out for Pfizer and Moderna. So we do, as Dr. Bennett mentioned, we really encourage folks who are 18 and older to go ahead and get those booster shots, especially as we head into the winter time, where, as everyone knows, there's lots of things going around, and the more protected you can be, the better. So definitely encourage everyone to get those booster shots.
Thank you, Dr. Morris. Let's see. Okay, next question. Hearing these personal stories about your sister and your own pregnancies is so compelling. Have you found that there is an effective way to communicate with people who are hesitant?
Well, I can start. Yeah, I think for my sister, it was patience and dialogue, quite frankly. And I think, for folks who've not yet decided to get vaccinated, we have to keep telling them it's their decision, right? And it's, they have to do it on the timeline when they're ready. And at the same time, this is one of the most safe and effective ways to protect ourselves and our communities from what is a very deadly virus. And so that the risk of COVID just can't be underestimated. This is a virus that nobody wants to have. And, as more information comes out about long COVID and the fact that the vaccines are really also protective against some of those impacts, again, the more the data is clear that the benefit really outweighs the risk here. But what we also know, and this was true with my sister, who, by the way, had a completely healthy, safe baby, and herself has been in really great health and had really no issues with the vaccine at all. The other thing that's really important from my experience with my sister is that, we find that it can take 4 or 5 conversations on average for someone who hasn't yet decided to be vaccinated to decide to go ahead and get vaccinated. And that is time well spent. We should have as many conversations as it takes is what we should do. And that's really what happened in my conversation with my sister. But yeah, I'm curious about you, Dr. Bennett.
It's interesting because I have these conversations with family and friends, obviously, but also with patients. I find that it's best to approach the conversation from a place of love and understanding, because most people, especially when they're pregnant, just want to do the best that they can and just want to do whatever is the best thing for their baby. And so I try to approach it from a sense of, I'm not trying to convince you to get the vaccine, because I think people feel very pressured right now and just like it's being pushed down their throat. So I like to take the stance of saying, my goal is to help you to make the best decision for yourself. And I want to be able to provide that information because I know there's a lot of misinformation there. I want to be able to answer whatever questions you may have without it feeling like a judgment zone. And so that's sort of my approach. It's not like I'm here to convince you to take the vaccine. I go at it like, hey, what questions do you have? How can I help you to feel heard? How can I help you to get your questions answered so you can make the best decision for yourself? Because ultimately, that's what every pregnant patient wants to do. They want to do what is safest for their child. Really, their cells are secondary almost always. And so if I can just sort of approach it from that realm, then it helps to have a better conversation. And even if they don't walk out saying, give me my jab right now, they walk out contemplated. They're thinking about it. They're going to have more discussions with their family so they can feel comfortable with that decision.
Thank you, Dr. Bennett.
If I could just add one more thing, I think there's a lot of emotion around the vaccine and getting vaccinated. And the other approach that I like to take is to sort of take out the emotion, at least from my standpoint, and just focus on the facts. Because the people who are coming to you are coming with the emotion. And I don't like to return that same energy. I just want to be, if there's a fact, if there is data that's available, I'm going to give you that because that's not debatable. Sort of, everyone has an opinion and that's true. And everyone is allowed to have an opinion, but there are some things that we can see, like here's the data, here's what happened here. Every pregnant patient that's gotten sick in our hospital system and probably across the United States, that's gotten very sick, that's needed to be in the ICU, et cetera, have mostly been people that are not vaccinated. That's not a debatable fact. That's not my opinion. So I think an important part of my role also as a physician and as a high-risk doctor at best is to sort of be able to provide the data so that we can clarify some of these. Here's what I think, and here's what I know.
Thanks, Dr. Bennett. Next question is for Tasha. With the information shared today, do you think this is the kind of information that doulas and patients are looking for to make a decision to vaccinate? Is there anything that we're missing?
Hey, yes, no, this is definitely the information. I've taken notes and we'll definitely go over this information myself, because where there's holes and gaps in what they're getting in prenatal and even postpartum, like we can fill those gaps. And like Dr. Bennett said, like giving them facts and information and data so that they can see it for themselves, and even going through the information with them. Because we're there to support and to help them find the answers, when they don't have them or not sure about what they're hearing. And I feel like there's a level of trust with their doula, especially if they've hired you on or they're welcoming you into this journey with them. They trust that you're not going to give them misinformation, and it doubly helps if our information lines up with what's already out there or what they're getting from their healthcare provider. If we're supporting that. I feel like it won't come across as manipulative, like, oh, you just want me to do this. If you've built that relationship that, you're just, it's their choice. It's like the epidural, like you can do this or not. I'm not here to judge you with what you do. I'm here to support you in the decisions that you make and to empower you. Like you don't take the vaccine like, oh, I'm just being forced to do this. No, you want to know why you're doing it, why it's beneficial, even if you're nervous about it. That data and information can be your solid foundation. Like, okay, I'm a little uneasy about this, but nothing about what I've seen data-wise is telling me that I should not do this, or that I should be unsure about this, or that this will be bad for my baby in some way, or even for myself. So yeah, no, this is definitely the information I've needed and wanted to be able to support my clients. This is a big topic, of course. So yes.
Thank you so much. I'm not sure if, am I on mute?
No, we can hear you. Now you are.
Now you're back on mute.
How about now? Good, great. So sorry that we ran over time, but this is such a rich conversation. I'd like to sincerely thank Ms. Tasha Phifer, Drs. Morse and Bennett, and Ms. Rios for such a fantastic and informative and thought-provoking webinar and discussion today, and for sharing your knowledge and expertise with us. And thank you to our audience for joining us today as well. As a reminder, the CHW Research and Resource Center at NYU School of Medicine aims to be a resource for community health worker training programs and research in New York City and beyond. We hope you can join us next month for our webinar on children and COVID-19 vaccines. Please do stay tuned for an announcement, and please fill out the poll that you have on your screen right now. And on the slide, you see all the names of the folks who made today's webinar possible at the Community Health Worker Research and Resource Center, New York SEAL, Caribbean Women's Health Association, the New York Health by Housing Lab, and the New York City Department of Health and Mental Hygiene. Thank you all so much for joining, and have a wonderful rest of your day. Thank you.
Thank you.